Hi guys, Dr. Amy Flanagan from the Healthy Back. I'm just here to kind of start talking about what the alpha-2 macroglobulin molecule actually does and what those type of injections will help with. That's what we're going to start with here at the Healthy Back and Body as we add our nurse practitioner, and we are just really excited. And just to explain, the alpha-2 macroglobulin, which is A2M injections, molecule is A2M, is an actual molecule that we already have inside of us. And what it is, it's a natural anti-inflammatory, very strong natural anti-inflammatory, and it also stops the degeneration process. So when we actually take that person that comes in's blood and concentrate it extremely, so this molecule is concentrated in a small amount, and then we inject it into that joint that still has cartilage or still has space, it will actually stop the inflammation process and stop the degeneration process. And so that joint just feels so much better. And this isn't a new thing. They're doing it all over the place in this United States, and they're doing a lot of it with sports athletes, and it just really helps with arthritis. It helps those people that have enough space but the pain is still there that they don't do surgery on, so it really helps those patients. And there's one thing just doing the injection, but here at the Healthy Back we have everything to make that injection 100% effective. And this is the reason why. So at one point there might have been injury in that joint or overuse, which makes sense. But because of the stuff that constantly inflames us, and there's tons of things that inflame us, just some of the foods we eat, our environment, our phones, that causes that degeneration inflammatory process to go a lot faster. And one of my biggest pet peeves is that, oh, I'm just aging, I'm sore. We don't have to feel like that. We can age well without those joints doing what they're doing right now. So that methylation protocol that we have actually pulls out all those heavy metals and crap that gets stuck in us that causes the inflammation to increase in our body and starts that degeneration problem and that disease issues. And so with the methylation, that detoxifies you of those heavy metals, which helps pull the inflammation out, okay? So then we have that here, and that's really easy to do, technically, because it's just a few supplements, but also with mitochondria support along with methylation, which usually is part of the methylation protocol too. But mitochondria's actually, the more we age, mitochondria kind of start dying. But if we put the supplementation in, mitochondria increase. And what mitochondria does is our little engines of our cells, but they regenerate us and they stop disease and they stop the inflammatory process. So by putting the mitochondria support in along with the methylation, not only does it pull out the inflammation that is causing these issues, it also helps regenerate the stuff that it's degenerated, including it helps repair our DNA. So, and you know, we've heard a lot about DNA in the last 3 years. So anyway, we have both of those procedures here. Also, with some of the reasons why people have knee or hip issues or joint issues is posture reasons. And a lot of times we're also here to help strengthen your posture and decrease that scar tissue that is blocking the circulation. And so our soft tissue technique, just like anything that has energy, it is a conductivity. It flows. And when everything is clear, everything's going to work better and flow better. And so that soft tissue technique, we make sure there is no restriction in any of our meridians or basically our energy lines to help function that body correctly. So when that is also fixed, you have the circulation and we don't have any like short circuits in our body. Also, we have just the typical posture rehab stretches, and we have foot levelers here if in case it is the foot issue. If you have flat foot, those joints are gonna wear down faster. It's just a given because our foundations are like caving in. So we have all that here. On top of that, we also have the post-electromagnetic frequency coil, and we're just gonna add what they call a Teslatron coming as well. And what that does when you're laying in this Teslatron, it's gonna also increase your mitochondria and pull out the inflammation in your entire body. So when you're pulling out the inflammation, you're clearing out all the short circuits that we have in our body, correcting the posture issues. Those alpha-2 microglobulin injections are going to be 100% effective and going to last. We are also going to make sure that that joint actually has space with some ultrasound diagnostic tools to make sure too. So we're just really excited to get started with that because everything we have here has been building up to this point. Also, if you are overweight, we know that you have to lose that weight to support that joint, and we have two awesome diets here with Shanice Gilsid's Fitucate, which is a 6-month program that really helps you educate how to eat healthy, and then we have the amino acid diet that really helps shed the weight and is a fasting diet. So, and of course we have our other classes here too, our yoga classes that help with posture, balancing everything out. And people don't know how important it is for even just normal breathing for your posture and your diaphragm, because that is our base of our core. And then also our spin to kind of help lose the spin classes to help lose that weight too with the cardio. So we're just really excited to get this started. We're in the process of getting everything here, getting a room ready. If this is something that you're interested, we can already get started with the methylation and the mitochondria support and the post-electromagnetic frequency, and also getting rid of all of that stuff that kind of stops the circulation in our body. We're just really excited about this because it really helps people, and all these people in this area really could benefit from it. So other than that, just keep listening to our videos because more and more is coming. I'm gonna keep looking into the alpha-2 and the A2M, how we can use it more and more, because there's other things that we can use it for, but we're gonna start using it with just the joint injections. So please give us a call if you have any more questions, 402-395-6957. Thanks, guys.